What is the role of imaging in MRD testing?
In the response criteria, you have the first level of MRD negativity, that's the bone marrow test. And the next level is when you're also negative in the PET. And today the guidelines are glucose PET, so it's only showing metabolically active lesions. And we know that the prognosis of patients that have remaining active metabolic lesions that are interpreted as myeloma after their first-line treatment, it's a very, very bad prognostic sign. So the PET is complementary in another way. You can have a bone marrow sample where there's no myeloma cells there, but there are foci other places. And the PET can, in many patients, show that. And that's also part of a worse prognosis. So I think maybe a very interesting thing is to see how the PET and the blood sample mass spec will compare. Because they are both sort of testing the whole body, while the bone and NGF and NGS are both testing just myeloma cells in a particular bone marrow sample. So there's sort of two unifocals and two global tests. And probably in the end they will be complementary of all of this. But the PET and the blood sample are sort of more convenient for the patient, of course, than regular bone marrows.
Also, imaging is included. There is another criteria beyond just MRD negativity. So there is something called MRD negativity with imaging included. So that means that the patient could be worked up with a bone marrow biopsy, found to be negative with an assay 10 to minus 5 or better. And if PET-CT is done and there is no abnormal uptake, then the patient would be negative with both. There are some individuals that are negative in the bone marrow, but they could still have some areas positive with PET-CT. If that happens, the patient could still fulfill the definition and the criteria for MRD negativity, but there should be a comment in the note that the patient is MRD negative, 10 to minus 5, but the PET-CT identifies residual disease. If the patient is monitored, is on therapy, if PET-CT is repeated and this area goes away, there is no abnormal uptake, the note should then say the patient is MRD negative and now the PET-CT is negative. It seems that clinically patients who are MRD negative with both the bone marrow and the PET-CT is negative, that the prognosis is even better compared to an individual who is truly MRD negative in the bone marrow but has some uptake in the PET. So being negative with both is the best.
How are PET-CT scans used to help determine MRD negativity?
You have heard a bit about MRD measurement, it's minimal residual disease. You have heard it's very important that this is as low as possible, that the response to treatment should be as good as possible. The problem is when we are negative with our free light chains, negative with the immunofixation, negative in the urine, we still can have some disease in the bone marrow. And then we do bone marrow biopsy here, which is the easiest way to get it. But the problem is that in a French trial that was mentioned several times now, they found that you can be PET negative, PET or MRI, either one, negative, and MRD positive. So you can stick a needle here, PET is overall negative, and you think, okay, great. Then you stick a needle in here and you're still MRD positive. Or you can be MRD negative, you stick a needle in here, but you have something growing here. So it's very important to have the whole picture, and the whole picture meaning as much of the body to image as you can, plus doing this very sensitive technique with the bone marrow. That's also a question oftentimes coming from patients. Since we have this very sensitive and great imaging techniques, do we really still need bone marrow? The bad news is yes, at the moment we still need it because we have to see how many of the patients, the sensitivity of the bone marrow biopsy is still much higher than our imaging techniques, but we are getting there. And I didn't promise you that we can get rid of bone marrow, so don't get me wrong. So this is kind of demonstrating that. You can see again this dark spot, which is a myeloma lesion. If you put in a needle here, it might be MRD positive. If you put it in this lighter gray spot, it might be negative. So again, I think it's very important to do imaging plus MRD assessment plus our serum and urine analysis. And this is showing if both is negative, MRD is negative and imaging is negative, then the prognosis is very good. And that's what we are going for.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take quizzes, and bookmark lessons. Visit the links in the description below to get started.